Hello, and welcome to this presentation of hypnotherapy as an intervention for obesity. My name is Sher Cal. I'm a registered respiratory therapist. I'm a certified respiratory educator. I'm a registered polysomnography technologist. I hold a certification in clinical sleep health, and I'm also a certified clinical hypnotherapist. So the objectives of this presentation are basically 4 basics. Define obesity and the goal in optimal management. Number 2, defining hypnotherapy and its relevancy to obesity. Number 3, describing the role of hypnotherapy in weight management. And number 4, describing the most optimal hypnotherapy technique to treat and support best weight. So where do we start? Definition is everything. What I went with when I did all my research and was looking into how and when do we treat weight management, I basically went to the most utilized tool that is out there. So I went with the World Health Organization, the American Medical Association, the Canadian Medical Association, Obesity Canada, and Italy. And they all define overweight and obesity as an abnormal or excessive fat accumulation that may impair health. And there is the key: that may impair health. Why do we want to fix it? It is going to affect your health. So they go on to explain a little bit more, saying that obesity is a complex illness caused by a number of different factors, both inside and outside of our control. We'll talk a little bit more about that later in the presentation. Most appropriate treatment, of course, then is going to encompass all of these factors that create this complex illness. How pervasive is this problem? According to the WHO statistics, this was gathered in 2021 in June. Worldwide obesity had nearly tripled since 1975. Between 1975 and 2021, nearly tripled worldwide. This is a huge problem. One of the other statistics that jumped out at me with this, there's many here as you can see on the slide. The first one being obesity is preventable. The difficulty with that is, where do we start? So that's a big part of what this presentation is going to get into. Where do we start? So we started with a little bit with the definition. And as we go into that, dive into that definition, what makes it a complex illness, we're going to get a little bit more into what sort of treatments are there and how we would like to approach it. The other thing that really popped out to me is that there's 39 million children under the age of 5 who were overweight or obese in 2020. 39 million children. So this is not just something that we have dealt with in the past. This is a growing problem. Globally, this was probably one of the most disturbing ones. I know as a child of the 70s, growing up as a young adult, understanding that the famine in Africa and that how so many people, even outside of Africa, worldwide, there was underweight issues. Now in 2023, globally, there are more people who are obese than underweight, and that there are more deaths linked to overweight and obesity worldwide than there are people linked with underweight. So lots of statistics that are telling us that this is something we need to address, and quickly. So what are the risks of obesity? I was talking about risks for morbidity and mortality. So what are we looking at when we're looking at morbidity, mortality? So we've got an increased risk for type 2 diabetes mellitus. We've got non-alcoholic fatty liver disease, gallbladder disease, and this was a surprising one for me, increased risk of cancers. Specifically, they were nodding to colon, kidney, and esophagus in both male and female, and endometrium and postmenopausal breast cancer in women. So as a population, we're seeing these comorbidities increase as the total body mass index increases. But on an individual level, we're seeing that risk actually more depends on detailed data, such as fat distribution, environment, genetics, and social, cultural, economic factors. So it's not just we look at the BMI and understand that our comorbidity impact on the individual is going to be the same. It actually isn't. But overall, we do see that these comorbidities increase as BMI increases as a population. So how does the World Health Organization classify weight status? They classify it into three areas. So obesity class 1, so strictly on BMI of 30 to 34.9. Class 2 is 35 to 39.9. And class 3 is, of course, anything greater than or equal to 34.9. So what we noticed when we're treating people for overweight and obesity is that although BMI provides the most useful population level measure, it should be considered a rough guide because, like I said, at an individual level, there are many factors that are going to be considered on how that's going to impact the individual. So one of the scales that I found consistently used, it was found in Italy, the US, Canada, and in several areas globally, was the Edmonton Obesity Severity Scale, or the EOSS. So even though it was designed by Canadians, we found that this scale, it's basically a severity scale that looks at many factors. So it's a 5-stage system of obesity classification that is based on overall disease severity. So it takes into account many things, multiple parameters, sensitivities to factors outside of the patient control, like genetics, environment, cultural, things like that. And the basic thing to take away from the Edmonton Obesity Severity Scale is that people in the higher stages require longer treatment time. They have greater risk factors and require longer treatment time. And the other thing too, of course, is that we use this scale typically to understand when we intervene, when we talk to people about managing their weight. So they recommend with the Edmonton Obesity Severity Scale that weight loss is recommended only in the severe stages. So I'll get a bit more into why we only do it in the severe stages a little bit later. So this is a really good study by Swartz and Company on the comorbidities as an indication for metabolic surgeries. So they took EOSS staging and applied it clinically, and they included some other factors in there. They used the EOSS as an augmentative tool, not the only tool. And I really liked what the clarity that they were able to come up with in this study. What they looked at was people with non-alcoholic steatohepatitis and non-alcoholic fatty liver disease. And these are type 2 diabetes mellitus, of course, as well. But these were all factors that are going to affect morbidity mortality rates. And so essentially what they did is they looked at the medical, mental, and functional impacts. And this is what EOSS staging does. But they also looked at some other factors in this and how they could apply this EOSS for these particular people. So in stage 0, which I see it as actually stage 1, but it's stage 0 of the 5 stages here, where we have the medical, mental, and functional impacts are absent. And then if you go to the other end of the spectrum on stage 4, the last stage of the EOSS, there would be end stage impacts on medical, mental, and functional areas that are impacting the patient. So if you apply that specifically to type 2 diabetes mellitus and NASH and a non-alcoholic fatty liver disease, you would find that in the first stage, there is no steatosis. And in the very end stage, we had cirrhosis and HCC, or hepatocellular carcinoma. So there's where the cancer piece comes in. And these are end stages of disease. And of course, as the EOSS implies, in these stages where we need longer stage, we need quicker intervention, and we need longer treatment time. This was another study. It was a clinical practice guideline that was developed by Wharton and Company for obesity in adults. They use the Edmonton Obesity Severity Scale as well, and they came up with a clinical practice guideline in general, not just for non-alcoholic fatty liver disease. And what they said basically is that one of the big things was asking permission. So getting the client's buy-in, and are you ready to be addressing what's going on with your health, with your weight, and how it's impacting you. They would understand with the Edmonton Obesity Severity Scale that they would be talking to people, asking permission, probably in later stages at about 2, 3, or 4, depending on whether there was symptoms going on with the client, whether they were finding subjective or clinical symptoms that were impacting their health and their quality of life. And of course, their first piece of this clinical practice guideline was asking the permission, is the client ready? And basically, it's building that patient-provider trust and showing the compassion and the empathy for the complexity of the condition that the client is experiencing. So of course, once you get your permission, you're assessing their story. So goals that are mattering to the client. So, you know, what is important to you about weight loss, and what is important to you about your health? Just because we might have an idea what would be optimal, we also want to know where they envision their health. Obesity classification, that's going to give us an idea with the BMI and the waist circumference, where they are clinically, and of course the disease severity, just getting a little bit more into that Edmonton Obesity Staging System. Number 3 is advising on management. So of course, we're going to get into that medical nutrition therapy. We're going to personalize the counseling with a dietitian and talking about healthy food choices and evidence-based nutrition therapy. Also going to bring exercise into that. The recommendation, this particular one was 30 to 60 minutes of moderate to vigorous activity most days. But of course, that's going to be patient dependent. There's also looking at the psychological approach. So cognitive approach to behavior change. That's where the hypno piece is going to come in a little bit later in this. Medications, of course, and bariatric surgery. So if you look at this guideline, it is very holistic in its approach. It's very patient focused. It as the patient drives the therapy, and that buy-in piece is super, super important. So weight management influencing factors. This is the hypnotherapy perspective. I'm just going to sneak in here at the beginning. And basically, there's the 3 components. And this is going back to that previous clinical guideline, just considering the mind, the body, and the soul, or the buy-in from that client. What do you want? What are your goals? So the psychological piece, looking at things like cultural, with holidays, and societal, with stigmas, how we perceive what is beautiful, what is accepted, what is not accepted. We are cultural creatures. We are social creatures. So that acceptance and that connection is really important to us. Personality, are you literal? Are you inferential in how you see the world? So are you very sort of cut and dry sort of person, or do you like to read between the lines? That will lend a little bit more on what your anxiety level is going to be like. And also mental health, just what's your perspective in general about how you feel about the world and your place in it. Physically, we're looking at the comorbid factors such as diabetes, heart disease, mental health, serotonin and dopamine pathways specifically there. Those are the things I'm going to get into a little bit later. And physical disability, all of those things, of course, how those are impacting you, the diabetes, the heart disease, it's going to change the way you're able to show up in the world, from the things that you're able to do physically, such as how you show up during holidays. If you're diabetic, you're not going to be diving into the sweets that are offered to you at pretty much every moment. And with the heart disease piece about how you're going to exercise, is that going to fit with the way the rest of your family may be exercising? And the last one is goals. So checking in to see, what does your ideal body look, feel, and act like? All of us have a specific body type and feel that is specific to us, and no one else can tell us what that is. We have what society tells us, and we do, of course, have a little buy-in to that, but for the most part, we have an idea of what feels right for us. And so in that case, is your current body health aligned to your goals or to someone else's? That's a really big question a lot of people don't think about. And the last one, just looking at this, is nutrition, availability, knowledge, and its purpose. So why are you eating? Are you eating for fun? Are you eating for nutrition? Are you eating for other reasons, for stress? So food isn't just a nutrition thing. It has a lot of meanings tied to it. And that's part of where this hypnotherapy piece is going to come in a little bit later. So focusing basically with all of these things in mind, we're focusing on best weight. And the best weight is how much weight you can keep off while living an enjoyable life. So this is in alignment with the EOSS. So what is hypnosis? Hypnosis is a state of consciousness involving focused attention and reduced peripheral awareness, characterized by a capacity for response to suggestion. That's a big mouthful. Basically, it's a state of intense focus to the exclusion of everything else on one thing only. So you're focused on one thing only and everything else melts away. So if you think about any time that you have been driving in your car and you're focused on the road in front of you and you lose your peripheral vision, or you are daydreaming in the middle of a lecture, or you're focused on a candle and you notice the rest of the room move away, or you're in an intense conversation with someone in a dinner party and you haven't even noticed what's going on around you for the last half hour. All of that is actually a state called hypnosis. It's a brain state. So everyone basically has been in a level of hypnosis through intensely focused activity. You can get there through intention by going through a hypnosis session, either from someone else or doing it to yourself. But every one of us has been in a state of hypnosis. And the key with hypnosis, especially with when you're wanting to create change in your life, is that you are motivated to change, that you are ready, that enough is enough, and you come to that point and something's got to give. So that's basically the people that I deal with every time. So what is hypnotherapy? The use of hypnosis for treatment of a medical or psychological disorder or concern is our basic definition of what hypnotherapy is. The treatments that we use are so many different types. Depends on basically what you're coming to see a hypnotherapist for. Some people want to know about past lives. Some people want to quit an addiction. Some people want to deal with their anxiety. And for each one of those things, we're going to use different techniques because those subconscious programs that you have created around those things that are troubling us require us to use the same tool to undo them. So basically, hypnotherapy in general, it just effectively uses perception changes to create better conditions of sleep, control over addictive type behavior, understanding more of trauma, control over pain, and a shift from anxiety into a state of peace and calm. So brain activity, this is what I alluded to a little bit ago about what hypnosis is. So it basically is a state of consciousness. You listening to this lecture right now are probably in a state of beta. So it's normal waking consciousness. This is where we basically are reasoning. So if you were talking quietly to somebody, watching TV or something like that, and you're into the program and it's not too captivating, then that's going to be beta. So it's about 14 to 40 hertz. Alpha, the next level down, is the gateway to the subconscious mind and intuition. This is the state that we see with daydreaming and light meditation. We also do neuro-linguistic programming, or NLP, in this state. We get some beautiful visualization that's done in this. It's actually very, very good place to use visualization. I'll go a little bit more into visualization there as well, and how important visualization is for change. Where I work mostly with people is on the alpha-theta border. So if you come in for a hypnotherapy session and I'm counting you down into this beautiful relaxed state of consciousness, you are going to hear everything around you, but you're not going to care. You're going to be focused on my voice, and you're going to be focused on the intention that we went in with. So in this sort of thing, it would be on weight management. It is the optimal range for visualization, and essentially we're in the alpha state most of the time with dips down into the theta. Now, theta is subconscious. It's the total realm of subconscious. So it's deep meditation, it's hypnosis, it's light sleep. And this is where we also see a lot of theta in REM sleep as well. So in the alpha theta border, we're going up and down between conscious and unconscious state. The client doesn't realize it because they dip down so briefly into the theta. It's when they get an idea or something pops up out of nowhere for them, an insight, that's from the theta realm. So the theta realm is got a lot of insight to it, but if you're not dealing on that alpha theta border, you're not bringing those insights up into the conscious realm where you can do something with it in a conscious sort of way. It doesn't mean that if we worked in the theta and you came out of a session and you went deep into theta, there's nothing that can stop me to keep people out of theta. I can try to bring them out. But when people want to go into theta, they're going into theta because they understand that this is where this is going to work best for them. They don't remember anything. I record the session and they can listen to it afterwards, but they're not going to remember it because they don't have a conscious state to remember it. It doesn't mean that nothing's going to happen. In fact, things actually happen quicker in the theta state because we're dealing directly with the subconscious mind. And as long as those suggestions are in line with what the client wants for change, then it's going to be accepted. And that's where we do the most beautiful reframing and work. I actually love working with clients in that state. Delta is the next state down, if you will, into the 0.5 to 4 hertz. And it's deep dreamless sleep, transcendental meditation, deep hypnosis. This is where they would do surgery. Back in the 1800s, they would do surgery with people using hypnosis because in those days, it was back in India, they actually didn't have the appropriate anesthetics for patients, and it was either they died or they attempted this. So actually found quite good results in India. The interesting part is India was quite well known for doing meditation and prayer. Prayer is actually the same mental state as hypnosis or meditation. And because people were so accepting to the power of the mind, that this worked so well in India. One of the surgeons that would use it there, when he came back to England to use it, he didn't find the same buy-in. So he didn't have as much positive effects with it. So it really comes down to what can you accept as possible. The last one is the insight wave. This one is where Dr. Joe Dispenza is working with. He's doing a lot of really cool research on this level. Basically, it's the brain lit up. It's both hemispheres working at the same time, most recently discovered. And it's associated with bursts of insight and high-level information processing. They're talking about states of healing that are quite fast. So how do we use these states? Basically, how are we training our brains every day? A lot of times we're doing things during our days. We don't realize we are training our brains to do things. Once we become aware of what we're doing and what we want instead, then we can focus on training the brain for something that serves our purpose. So basically, if you look at high beta is where you would have, it's in that much higher range up into the 40 hertz. You would see us in fight flight mode, increased focus, alertness, agitation. The brain is built to be in this way. It's going to focus on one thing, basically running from a bear, and it's not going to look at anything else. We see this a lot with attention deficit disorder. So when we're helping these people to bring a greater awareness and openness and calmness, we're bringing them out of that high beta and closer into the low beta down to the alpha. If we have people that are practicing low beta, so this is just being calm, breathing, coming back into present moment and awareness, that's where they're going to feel more relaxed focus and attention. If we're trained with meditation in this low alpha, we've got this inner awareness of self, mind-body integration. That's where we visualize, that sort of thing. And then the high alpha, centering, healing, mind-body connection. So it's just basically becoming more and more aware of present moment, how you're feeling in your body, how your thinking and your body responses are interplaying with each other. The alpha-theta border, this is the hypnosis piece. A lot of my clients are surprised at how quickly that every time they do a hypnosis session, whether they've done self-hypnosis or they've come to me for the session, that they're able to get into hypnosis quicker and they go deeper every time. So they notice that they visualize more, that they have more abstract thinking, and they have more self-control because they are more in touch with their goals, their higher values, than they are with what's going on outside of them. The theta wave activity, of course, this is that drifting trance-like state. This is one that we experience in sleep. When we suppress it, we get improved concentration and attentiveness. Of course, that's bringing us up higher. And delta wave activity, this is again in deep sleep, we get growth hormones secreted for growth, for body repair and regeneration. So when they say, your mom said to get some sleep to heal, she was right. So what does a hypnotherapy session look like? I think a lot of people have some interesting ideas about this one, and it's not what you think it is. It's actually quite mundane. It's basically, we have a rapport. I talk to you about, what do you want? A lot of people come in knowing what they don't want. And unfortunately, what you focus on is what you get. So that's all that they've been getting. So what we do is reframe them back, get some more clarity on what they actually want. We set that intention and expectation, and we take that intention and we use that as our focus for hypnosis. Because the difference between hypnosis or hypnotherapy and meditation is that meditation is just about calmness. It's just about expansion. It's just about coming back to who you are. Whereas hypnotherapy is that quietness, that expansiveness with one specific intention in mind. So it's a goal. So we have to set that intention. I'll recenter you, refocus you inward, and get into the body perception. We do boundary work here. I'm going to get into more of that a bit later. This is basically where a lot of people, especially who come into my office and they're very jittery, they high anxiety, they're having difficulties calming themselves. And what they found is they didn't even feel their bodies. They didn't even understand that they had a sore back. They were so unaware of being calm and here and present that once we brought them back there, now they can attend to what's going on. Then we do an induction. It's shifting you away from the body awareness. So it's interesting. We bring you back in, we increase your body perception, and then we shift you away from that body awareness. So it's a way of calming you down, using your body to start with the centering, and then we bring you into the mind with the induction. And then as we deepen you using some visualization techniques, we get you into the right level of state that we're looking for. Sometimes I just want people in alpha. We're just going to visualize. Other times I want people in alpha theta because we want some bursts of insight in there. And then we look at reframing. So we put in the hypnotic suggestion to update that old subconscious program or limiting belief now, and create instead what the client wants, the intention that we went in with. Once we bring them up out of the hypnosis session, we anchor in that subconscious learning more into that conscious state. So we're bringing that inside world out into the outside world and showing you how you can implement it in a way that's going to support you fully. So what does weight management look like in a hypnotherapy session? Again, exact same process. We set our intention and our rapport with expectation. discussing all of the factors, the biology factors, the psychological factors, the social factors, all of these limitations that people perceive are on them. And we also talk about what is your best weight? What is your goal, not someone else's goal, and getting more clear on what is supporting the client in best weight. We take that and we put that into our session. We do our centering technique, refocus the client inward, back into the body perception. I work on boundary work here. Boundary work, I'll get in a little bit more, is basically about understanding how the outside world impacts you on a physical level. And I give some people some interesting techniques to use in this particular part of the process. We shift away from the body awareness in the induction. I use some visualization techniques to get them deeper into that alpha-theta. And then we reframe. We reframe all of those subconscious programs, triggers, limiting beliefs, and we reframe it to that which is desired instead. So realigning people to their inner values. Now, inner values, people are, what is an inner value? Inner value is something like strength, love, clarity, all those higher feelings, basically. And one of the most popular things that we will use, one of the most popular techniques is called cognitive rehearsal technique. And again, we'll get into that. And then, of course, once everything's reframed, we bring the person up out of hypnosis, and then we anchor in that subconscious learning. So it's basically a discussion on what they noticed. And a lot of people come out of it going, wow, I had no idea I had that thought. I had no idea that's what was holding me back. I had no idea that that block was there. I had no idea that that negative reframe was there. And then we talk about now how this new way of looking at the world, this acquired perception that's more aligned with the person, is going to work in this world. So this was an interesting study that was done by Comza and Company, eating behavior. So was it choice or reconstruction of past experience? So they did a randomized clinical trial of changing eating intentions of healthy adults through hypnotic suggestions. So what they found basically was that psychological interventions have small to medium effect on weight loss, but people decide to act before they acknowledge it. There's a very, very small thought process that happens actually before they actually act. So decisions are based on prior experience as well. And what they found to change the decisions that are made, so changing a decision instead of picking up the chocolate bar, looking at what was the thought that happened before that decision. So going back and figuring out what those questions were, what that thought process was, and reframing it through cognitive rehearsal. They found that was the most effective. So what is cognitive rehearsal technique? So basically, it's a cognitive behavioral therapy technique. So it's derived from CBT. It's defined from the APA as a therapeutic technique wherein the client imagines a situation producing the anxiety or undesirable behavior, in this case, eating, and then either repeats positive coping statements or imagines desired behavior instead. So in a hypnotherapy session specifically, what I would be doing is having the client go back and imagining them making a decision that's fully supporting them in that moment instead. So instead of making a decision that's leading to a behavior and a result that causes guilt or shame or blame, they're going to make a decision that's fully supporting them, and also understanding why they were making the old decisions in the first place and how they can meet those other needs, possibly fulfillment, nurturing, nourishing concepts with things that are more supportive than what food was meant for. So in hypnosis, basically, we role play this, what should have happened within the subconscious, and the brain just doesn't know the difference between us rehearsing it and actually carrying out the behavior. So when I have a client carrying out a behavior in the subconscious, in a good way, their brain goes, oh, okay, we have experience now, and we tried this, and now we know that this actually feels better. And so it's a safe way of them trying on a different way of responding to their environment without the consequences. And in fact, getting desirable consequences. So the result is that feeling of preparedness for future exposures and a belief that they can have that desired outcome because actually they have experienced it. So this was another interesting study done by Roslin and Company. And the barriers, it was basically on the barriers and facilitators of healthy lifestyle change. So it was a qualitative exploration of weight loss experiences through hypnotherapy. So basically what they looked at is they had all these semi-structured interviews, recorded, how much weight was lost after how many hypnotherapy sessions. And what they found, this was the most interesting piece, all participants contended that hypnotherapy played a role in their weight loss journey through increased mindful eating and enhanced motivation to make lifestyle modifications. So enhanced motivation and the mindful eating are the two pieces I'd like you to remember on this piece. Those are the pieces that hypnosis is geared towards. So bringing awareness and slowing down why we do what we do, what questions we're asking ourselves, how we are supporting ourselves and how we're not supporting ourselves. That's the mindful piece. And enhance motivation to make that lifestyle modification. One, because with the cognitive rehearsal technique, we're gaining experience in a positive way. And there's no worry about what will happen if we don't do this or we do this. The other thing that this study came up with, or clarified, sorry, was that the barriers to healthy lifestyle changes were related to cost and lack of support for healthy food sources in the social and family settings. So that goes back to that social cultural factors about how do we associate feelings of inclusion and connection. And a lot of that goes back to a lot of our culture. Think about the food in your culture and how much that plays a role in how you connect with family members, the most important people in your family. And now if you try to change that, if those aren't also supporting your body, your nutritional needs, what that impact is going to be to the connection that you have with those people. So in general, what they found here is that hypnotherapy was essential as an adjunct tool in assisting weight loss, but additional efforts were needed to improve support in the weight management journey. This was a really important factor. Hypnosis is one piece. This is a complex illness that requires multiple tools for multiple factors. So we can't just say, oh, we're going to hypnotize you and you're never going to want to eat that chocolate bar again. This is more about becoming more aware and building healthy habits based on what works for you. And also understanding what nutrition is good for me, for my body, and how do I go about facilitating that on a long-term basis. So we need the mind, the body, and the soul to be thought about in this whole process. And hypnosis is only one of those. So mindfulness, we're going to go a little bit more into mindfulness. So basically, we hear this all the time, mindfulness, being mindful, meditation, all of that. It's gained a lot of popularity in the last several years through things like yoga, breath work, things like that. You hear them all the time now, whereas 10 years ago, you didn't hear about them. But basically, if you think about mindfulness, it's experienced in alpha meditation or alpha-theta border hypnosis states. It's a tool basically that helps us shed light on the motivation behind our unconscious actions, and it creates space to allow alternative motivations in. So it basically gives us this ability, the safe space to try on new ideas of reacting to things in our environment without risk. We can visualize, imagine, and focus when the conscious mind is quiet with our subconscious mind, which is the part that supports us fully, even though sometimes it isn't. It's only because we haven't updated those programs to support us fully. What supported us when we were 5 doesn't support us now, but those 5-year-old subconscious programs are still there. So that's where we go back in with mindfulness. We look at those programs and we update them to serve us better in our role now as an older adult. When we do this, it allows for change to happen quickly through focused, subconscious rehearsal of new behaviors and now expected outcomes. So this is neuroplasticity, the basis of neuroplasticity. We create new behavior through actual brain change. So how does mindfulness work with diet? So the space and awareness provides awareness on our triggers or motivation for past poor choices. So we all know that word triggers, right? I'm going to get into that a bit more later. The space of an objective mindset provides opportunity for new motivation to form with awareness of balance and alignment to internal values instead of external ones. What we find a lot is when people are anxious, they are focused on the outside world and they are not focused on their inner quiet world at all. The problem is they're trying to focus on what does the world need from me, and you can't know that. People can tell you, and if you are a literal person, then you're going to probably take them at their word. If you're inferential, you like to read between the lines, you're probably going to need a ton more information before you're going to trust that you know what they mean. And that's where things like anxiety come from. We're moving the client away from losing or controlling weight. Hate those words, don't like those words at all, because what happens with losing or controlling, if you use a word such as lose or control, the mind takes that and takes notice right away. And it goes, oh, we don't want to lose anything, and we don't want to be controlled. That doesn't support you. So it doesn't matter whether you put the word lose with weight, it's going to think it's losing something and it's going to hold on to it. Because for you to have something as opposed to not having something is more supportive of your survival in the subconscious mind realm than not having it. So it moves the client away from losing or controlling weight and back towards balance, harmony, and peaceful feelings of satisfaction on all levels. It allows the potential for perception change around perceived barriers to change. One of the beautiful things I love about hypnosis is that we get to see any situation from not just our point of view, but from the point of view of the other person involved in the situation, or even a bystander, first, second, or third person point of view. And that perception there is everything. It gives us such a more expansive, wider, more informed view of what is actually going on. Because if we only look at something from our view, that's one filter, and it's a very, very fine filter. If we start to bring in everyone else's perception, we get to pick what else could possibly support us as well. And so when you do that in the hypnotherapy piece, this is the cognitive rehearsal piece as well, it allows you to get all of that. And it basically, we're allowing the potential for perception change around all these perceived barriers to change. People often come in saying, well, I can't do this because someone will think that. And when they go into hypnosis and they realize, well, that was them, that was this person putting that expectation on the other people in their lives, and it wasn't actually true. They remove that barrier, that perceived barrier to change. It's beautiful. Empowerment to choose and recenter within, it just strengthens this new path and sets the tone for long-term success. So basically understanding that you have the ability to choose how things go in your life through perception creates these new ways of thinking and neuroplasticity. So basically think about it this way. If you have one way of thinking about things, that let's say the earth is flat or earth is round, whatever you want to say about it, you're going to think in that one way. And those neurons in the brain that understand that one way of thinking, is going to be very well used and strong. If you decide to change that behavior or that perception to a different one, you'll stop using that path, just like a footpath. And once you stop using that other path so much and you go on to the other one becomes stronger. And you get what we call neuroplasticity, or actual brain change that supports thoughts and behaviors and perceptions of the world. So this is where we go with the motivation piece as well. So how are we motivated? So is it internal, where you are personally gratified, you feel fulfillment, you feel, wow, I did such a great job. And it's not dependent on anything outside of you. You just know you did something right. Externally is about praise, recognition, rewards. It's kudos, which is nice. And it's not to say that that isn't. It's just that there are two types that we don't realize that we have. They're based on values, so joy and connection, or fears, which are typically shame and blame, all of which are formed within the subconscious mind. So the interesting thing about fear is that fear-based motivation is short-lived. So if you are afraid of someone popping out of a closet, and then you open up the closet door, no one's there, okay, you're good, within a very short period of time. So once the fear subsides, so does the motivation to run. You have no motivation to do anything because the fear is now gone. So since fear is perceptual, it can be reframed if the awareness is there to do it. If you don't have the awareness, you can't reframe it. The interesting thing about values, if it were based on high values, such as self-love and joy, this is where our motivation is coming from, then the motivation is long-lasting and it's transformative in all areas of people's lives. It once the joy and the self-love isn't as present anymore, we still understand that is still there. It's not like fear that way. The motivation is long lasting, and we just keep becoming motivated to do something. As long as we know that love is there, and that we are worthy, and that it is a possibility in our lives, that's for us. New perspective is focused within instead then, as well as the awareness of the ability to change, generates long-lasting feelings of empowerment, fulfillment, confidence, and self-love. Subconscious mind programs and triggers. This is the realm of hypnotherapy. So the subconscious mind, if you think about every experience you've ever had with all 5 of your senses from the moment you were born, it is there in your subconscious mind. It is there. It's the warehouse of every one of your experiences. And every experiences you gave a meaning to in your world. And you gave a meaning to it at the time that you experienced it, and it stayed the same, unless you consciously go back and you reframe it to something else instead. So if you were 5 years old and you learned that cars were scary, you would always have a little bit of a trigger with a car, because that 5-year-old understanding of what a car was like, it was maybe too noisy, or it was maybe too fast, or maybe it was very big, was something that scared you. That's put away in a subconscious program that's meant to protect you from the scary thing, that's meant to hold your highest well-being, your protection, your survival. And now that's carried forward. So every time you see a car when you're older, you might have a little twinge, which is what we call a trigger, or you might have a bigger reaction depending on the person. Now, if you become aware of, boy, this is silly, every time I see that car, I must think cars are like that. Cars aren't like that. I'm going to be very aware of this. You know what? Cars actually are a really good thing. If you're aware enough to reframe that trigger, it now becomes a positive thing, and that changes the behavior. So to change the behavior, we can directly change that subconscious program, add in more effective coping tools. So now the car is something that's going to transport you places. It's going to be fast. It may be fun. So we reframe it or we remove it altogether, and now we don't have any feelings about cars. It depends on what the person wants. It's what they can accept. So basically, when we become conscious of what we accept as supportive to our well-being, we start to question, then change other behaviors that are not in line with our values. So in this, like in this picture here, you see the one box lit up. That one box, if you notice, there's light on a bunch of the little boxes around it. It starts to shed light on everything else, just like the one subconscious program you changed. Because the subconscious mind, when it becomes accepting of a new concept, a new idea, it starts to look around to look for evidence that this is true. And so if you're looking for something, you're going to find it. Like if I tell you each and every time you see a red car, you're going to think of this, this presentation. The next time you see a red car, this is going to pop up. That's a hypnotic suggestion, even in the space of being conscious. So if you accept that suggestion that I made, every time you see a red car, you're going to see this. You're going to think of this experience. If you don't accept it, you're not. Boundaries. This is the boundaries work I promised to talk about. This is where basically I talk about boundaries with people with centering. So boundaries are either restrictive in nature or supportive, depending on the location. So a lot of people, when they've been through difficult things, and we've all been through something traumatic to one degree or another in our lives, because we are human, we have put a little wall up just to protect it. We don't maybe not have been aware of that wall. Maybe we have, maybe we haven't. People have been through extensive trauma, will have difficulties opening up to people, difficulties with trust. And what we see with those people is their boundaries are very close. So they're inside, they're in the heart, and those boundaries are impermeable. So they have difficulties feeling any feeling, not just the bad ones, all of them. Healthy boundaries, on the other hand, are outside of the body. So they're carried around us like these big shells of light, basically. I have people visualizing them however they want to. And they're permeable, semi-permeable. So they let in the things that fully support people, and they keep out the things that don't. So people don't realize they can change them to align closer to their core values or create the space they need for the environment. So let's say you have a boundary that's, pretty big. It's all around you. You're in a big space with very little people. You're going to have a big boundary. Someone comes into your space and you're in this massive space and you're the only two people there. You're not going to feel comfortable because they are within your boundary. Your boundary is actually like probably 10 feet out from you. But if you're in a crowd, like at a concert or something, you're going to be shoulder to shoulder with people. Your boundaries are probably going to be right next to your skin. You're going to expect people to be close to you, and it's okay, because now you've just changed where your boundary is. We can strengthen these boundaries with visualization, and we can use them to keep out things that affect us, like fear, anxiety, all kinds of different things. And we can also bring in tools that support us. So this is another piece that I wanted to get into. Very, very interesting, the dopamine drive. It's going to, there's a little bit more evidence that I'm going to bring up around this, but basically the dopamine drive, it's a very interesting reflex that happens. So what we get is we get a thought, so an expectation of receiving a reward, and it triggers dopamine signaling from the ventral tegmental area. So that's area A there in the brain. And it sends dopamine out to those areas B, C, and D. So those are, E as well. And these areas are responsible for motivation and action, learning and memory, and decision-making. And in addition, we have emotional associations that are also made in the areas of D and E, so the prefrontal cortex and the amygdala, so the older brain. Now, the interesting part about this is it is not the reward itself that allows that feeling then, it's the anticipation of the reward. So the reward isn't the reward, it's the expectation of the reward. So let's say you want that cup of coffee like this woman is holding here, and you think, oh, I want a cup of coffee. The moment you think that, you get dopamine that goes from that one space to 4 main areas in the brain, and it's going to motivate you. It's going to give you an idea of how to act, It's going to teach you how you can do this over and over and feel better. And it's going to take part in decision making. And on top of that, you're going to have an emotional association with that, which firmly cements learning and memory further. Anytime you have an emotional situation, anytime, you're going to notice that your memory around those emotional times are the memories that you remember most. So the interesting part is you feel that sort of, I need that hit. Maybe it's a cigarette, maybe it's coffee, maybe it's chocolate, maybe it's sugar, maybe it's a donut. I don't know. Whatever you want. Think of your trigger. That trigger, that thought of the thing that you need, that feeling that you get is the reward. Getting the thing itself actually stops the dopamine response. The dopamine's a feel-good drug, basically. We make our own feel-good drugs. And the interesting part is the more anticipation there is, if you can smell the coffee, you're in your house, you know, all it takes is for you to get up out of your bed and go and get it. The more dopamine happens, and the result is a stronger drive to perform that behavior. If I take you out of that situation, and you know, you have the thought, I could get a cup of coffee, but you're in a place that there is no cup of coffee, that actual response, that drive, that need to get up, and that motivation is not going to be nearly as strong, because you know you can't get the reward. And so the coffee, if you were to have one given to you without anticipating it, isn't nearly as good as anticipating something. It's like Christmas. It's not about Christmas Day, or it's not about Hanukkah, or it's about the lead up to. It's about the anticipation. So going a little bit more into this from the chemical level, this was an interesting study on effects of hypnotherapy on weight loss, and thus on serum leptin, adiponectin, and irisin levels in obese patients. So what they did is they took 32 patients with a BMI of greater than 30, attending an outpatient psychiatry clinic with the intention of developing a healthy and balanced diet. They did 10 weeks of hypnotherapy. They took BMI and blood samples at the beginning and the end of the study. So at the beginning of 10 weeks and the end. The result was they took the BMIs again, and the serum leptin levels and the BMI levels decreased, or sorry, the levels increased significantly. Now, the BMI and serum leptin levels decreased significantly after the hypnotherapy session. Now, the interesting part about BMI and serum leptin is with a decrease in adipose tissue or decrease in BMI, you get a decrease in serum leptin. Whereas serum ADP or adiponectin increased significantly. And this is in relation to insulin sensitivity. So we have higher insulin sensitivity levels. So now the difficulties, if you understand diabetes, type 2 diabetes, is insulin insensitivity. So with dropping the weight, we get an increase in insulin sensitivity, as well as the irisin levels, which is improved lipid metabolism. And we move from white adipose tissue to brown adipose tissue, which have very different impacts on morbidity mortality rates. So in conclusion, the study indicated that hypnotherapy and obesity treatment led to weight loss in obese patients, and thus to considerable changes in leptin, adiponectin, and irisin levels. They found that hypnotherapy was easy to apply, it was cheap and effective, and it had no potential for side effects. And it could be also applied both alone or in combination with other treatments. However, to confirm its effects, they recommended further studies because of the sample size. This is another one talking about adiponectin modulating the ventral tegmental area. Now, remembering the ventral tegmental area is the one that sends out the dopamine signals to the 4 areas of the brain. We understand too, like the adiponectin, which is that hormone that comes from the fat tissue, crosses that blood-brain barrier. And they basically said that the adiponectin can directly modulate the dopamine neuron activity and anxiety behavior. So directly affecting how anxious people are feeling as well. So really, really important physiological changes that we see just from doing hypnotherapy. This was another one about hypnosis and food impulsivity and weight loss. This one was done by DeLester and Company. So it was a randomized controlled trial, basically looking at how hypnosis affected food impulsivity in patients with obesity and high levels of disinhibition. So people that had difficulties not being impulsive about their eating behavior. So what they concluded was that it was a management of adults with obesity and a high disinhibition score. Hypnosis and self-hypnosis can significantly improve the deep mechanisms of eating behaviors, and they seem to have a beneficial effect on weight loss. So interestingly, 67.7% of adults in the hypnosis group had normalized their disinhibition compared to 11.1% in the control. That is huge. So very, very interesting ideas here about how impulsivity and weight loss are significantly affected by hypnosis. Thinking again about that dopamine pathway and the impulsivity that happens with the motivation factor. This is, you know, a narrative review that was done. This one was done back in 2021 by Roslin and Company. And basically, they're going on about how hypnotherapy is gaining recognition for overweight and obese patients for a therapy. And that basically that hypnotherapy not only promoted weight reduction during the treatment period, but also after treatment cessation. And again, what they noted too is that there couldn't be a lot of definitive conclusions drawn because there was a lot of methodological flaws, specifically around the limited number of published studies in this particular area. So a lot of these authors are seeing the possibilities here and seeing these amazing sort of results, but we need more studies to definitively conclude. So in summary, obesity is a complex illness caused by multiple factors, both inside and outside of our control. Our most appropriate treatment is therefore multifaceted and based on best weight. Obesity risk as a population is determined mainly through BMI, but we can't take that at the individual level. We also have to consider many, many other factors besides BMI when treating the individual. It's a growing problem. 39 million children under the age of 5 overweight or obese in 2020. This is a growing problem. Hypnotherapy is an adjunctive therapy in the holistic plan shaped for the individual. See that many studies that we talked about earlier, and it's been demonstrated to play a role in increased mindful eating and enhanced motivation to make lifestyle modifications. It works within the conscious and the subconscious minds to increase our awareness of programs that we have that are fueling our thoughts and emotions and behaviors. And we're able to empower the client to reframe those using techniques such as cognitive rehearsal. Hypnotherapy is gaining recognition as an effective and adjunctive treatment for obesity and overweight challenges, despite the lack of large and well-designed studies available. These are my list of references, and I thank you so much for listening to this presentation. And if you'd like to reach out to me, I can be reached. You can look further on the website, and I'm sure Terrence can do that for you. And this concludes my presentation.